Toxoplasmosis is an infection caused by a parasite called Toxoplasma gondii. This tiny organism is remarkably adaptable and can infect a wide range of warm-blooded animals, including humans. T. gondii is a protozoan parasite, which means it's a simple organism that's more complex than bacteria, but simpler than animals or plants. The life cycle of T. gondii is quite interesting. It primarily reproduces in cats, which are its main hosts. When a cat becomes infected, it sheds millions of oocysts, or egg-like structures, in its feces. These oocysts can survive in the environment for months or even years, waiting to infect a new host. Other animals, including humans, can become infected by ingesting these oocysts or by eating undercooked meat from animals that have been infected. Toxoplasmosis is surprisingly common. It's estimated that up to a third of the world's population has been infected with T. gondii at some point in their lives. However, the prevalence varies greatly between different countries and regions. In some areas, infection rates can be as high as 90%, while in others, they may be as low as 10%. Causes of toxoplasmosis. There are several ways you can become infected with T. gondii. One of the most common routes is through eating undercooked meat, especially pork, lamb, or venison. These animals can harbor tissue cysts containing the parasite, and if the meat isn't cooked thoroughly, the cysts can survive and infect you. Another way to get toxoplasmosis is through contact with cat feces. This might happen when cleaning a litter box or gardening in soil where cats have defecated. It's important to note that the oocysts in cat feces aren't immediately infectious. They need to spend at least 24 hours in the environment to become infective. This is why pregnant women are often advised to avoid cleaning litter boxes. You can also get toxoplasmosis by eating unwashed fruits or vegetables that have been contaminated with T. gondii oocysts. In rare cases, organ transplants or blood transfusions from infected donors can transmit the parasite. One particularly concerning route of transmission is from mother to child during pregnancy. If a woman becomes infected with T. gondii for the first time while pregnant, she can pass the infection to her unborn child. This is called congenital toxoplasmosis and can have serious consequences for the developing fetus. Symptoms of toxoplasmosis. The tricky thing about this infection is that most people who get it don't have any symptoms at all. Their immune system keeps the parasite in check, and they never know they've been infected. This is why toxoplasmosis is often called a silent infection. However, some people do develop symptoms, especially if their immune system is weakened. When symptoms do occur, they're often mild and flu-like. You might experience swollen lymph nodes, particularly in your neck. You could have muscle aches and pains that come and go. Fatigue is common, and you might feel like you just can't shake off your tiredness. Some people develop a low-grade fever that persists for several days. In rare cases, toxoplasmosis can affect the eyes, causing a condition called ocular toxoplasmosis. This can lead to blurred vision, red eyes, and sometimes pain. It's more common in people who were infected congenitally, even if they didn't have symptoms at birth. For people with weakened immune systems, like those with HIV or AIDS or those undergoing chemotherapy, toxoplasmosis can be much more serious. In these cases, the infection can spread to the brain, causing encephalitis. Symptoms might include headaches, confusion, poor coordination, and seizures. This form of toxoplasmosis can be life-threatening if not treated promptly. Congenital toxoplasmosis, where a baby is infected before birth, can have a wide range of effects. Some babies are born with severe problems like hydrocephalus, or fluid buildup in the brain, calcifications in the brain, or eye damage. Others may seem healthy at birth, but develop symptoms later in life, such as hearing loss, vision problems, or learning disabilities. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of toxoplasmosis. Diagnosing toxoplasmosis can be challenging, especially since most infections don't cause symptoms. If a doctor suspects toxoplasmosis, they'll typically start with a blood test. This test looks for antibodies to T. gondii in your blood. There are two types of antibodies they look for, IgM and IgG. IgM antibodies show up early in the infection and usually disappear within a few months. If you have these in your blood, it suggests you've been infected recently. IgG antibodies, on the other hand, develop a bit later but stick around for life. If you only have IgG antibodies, it means you were infected at some point in the past. In some cases, especially for pregnant women or people with weakened immune systems, doctors might do more specific tests. They might look for the parasite's DNA in your blood or other bodily fluids using a technique called PCR, or polymerase chain reaction. Sometimes they might need to take a sample of tissue, like from a lymph node or the brain, to look for the parasite directly. For babies who might have congenital toxoplasmosis, doctors often do a series of tests. They'll check the baby's blood, spinal fluid, and sometimes their eyes and brain to see if there's any evidence of infection or damage. Treatment for toxoplasmosis. For most healthy people who get toxoplasmosis, no treatment is needed. Their immune system will keep the infection under control, and they'll never have any problems from it. However, there are several situations where treatment is necessary. Pregnant women who get infected during pregnancy usually need treatment to reduce the risk of passing the infection to their baby. The most common treatment is a combination of drugs called pyrimethamine and sulfadiazine, along with folinic acid to help prevent side effects. These drugs work by interfering with the parasite's ability to reproduce. People with weakened immune systems who develop active toxoplasmosis also need treatment. They often receive the same combination of pyrimethamine and sulfadiazine, sometimes with the addition of other drugs like clindamycin. Treatment for these individuals may need to continue for a long time, sometimes even indefinitely, to prevent the infection from reactivating. For people with ocular toxoplasmosis, treatment usually involves a combination of antiparasitic drugs and steroids to reduce inflammation in the eye. The exact treatment can vary depending on the severity of the eye involvement and the individual's overall health. Babies born with congenital toxoplasmosis typically need to be treated for several months to a year after birth. They receive a combination of antiparasitic drugs, often along with close monitoring of their development and regular eye exams. It's worth noting that while these treatments can be effective, they can also have significant side effects. Pyrimethamine, for example, can cause bone marrow suppression, which is why it's always given with folinic acid. Sulfadiazine can cause allergic reactions in some people. Because of these potential side effects, treatment decisions are always made carefully, weighing the risks and benefits for each individual. Prevention of toxoplasmosis. Since it's such a common infection and can have serious consequences for certain groups, knowing how to avoid it is important. Here are some key prevention strategies. First, you need to cook meat thoroughly. This is especially important for pork, lamb, and venison. Use a meat thermometer to ensure the internal temperature reaches at least 145 degrees Fahrenheit or 63 degrees Celsius for whole cuts of meat and 160 degrees Fahrenheit or 71 degrees Celsius for ground meat. Also, you need to wash fruits and vegetables thoroughly before eating them. This helps remove any potential T. Gondii oocysts that might be on the surface. Practice good hygiene when handling cats or cat litter. Wear gloves when changing litter boxes and wash your hands thoroughly afterward. If you're pregnant or have a weakened immune system, it's best to avoid changing cat litter altogether if possible. Other than that, cover children's sandboxes when not in use to prevent cats from using them as litter boxes. Avoid drinking untreated water, especially when traveling in areas with poor sanitation, and wear gloves when gardening and wash your hands afterward, as soil can contain T. Gondii oocysts. For pregnant women, it's also recommended to avoid high-risk foods like raw or cured meats, unpasteurized dairy products, and raw or undercooked eggs. Now, we want to hear from you. Did you or someone you know have toxoplasmosis before? What symptoms did you have? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.